Welcome back. In this video, we'll compare the 5 types of hepatitis viruses. All of these viruses will cause liver failure, sometimes acute and sometimes chronic. So the patient will present with symptoms of liver failure. The symptoms start with jaundice and can progress to portal hypertension, pulmonary erythema, and other symptoms of liver failure. The hepatitis viruses are named A, B, C, D, and E. Type A and E, the first and last, transmit by fecal and oral route. So remember, fecal from the last letter all the way to oral, the first letter. All other types are only transmitted by blood. This can be in the form of needle injections, sexual partners, dialysis machine, etc. Type B is very boring because it has a very long incubation period, which means that the patient will be infected with the virus and only months later does the virus start working. Type D is a super infection, which means that it requires another infection before it starts working. Basically, the type D virus doesn't have a shell, and so it uses the shell of type B virus. So before somebody is infected with type D, they have to have type B infection beforehand. Again, the couples A and E have short incubation period, and type C have longer incubation period. Symptoms and complications wise, type A is very mild, and it starts very quickly. So pretty much as soon as somebody is infected, they will start showing symptoms. But luckily, as they say, easy come, easy go, so it doesn't last very long. And most of the time, it doesn't really need treatment. So the prognosis is very good. Type B and C progress very slowly, and the symptoms start very slowly. They both, however, can be very severe and progress to chronic or even cancer. Type D is the worst, and if the patient has type D, the formation of hepatocellular carcinoma is almost definitive. Type E is not really malicious unless if the patient is pregnant, in which case it will cause fulminant hepatitis, which is just another fancy name of acute liver failure. The mortality rate in pregnant women with type E is very, very high. So type A and E are not cancerous, and every other type is very cancerous. Type B and C can be chronic, so they can have a carrier state, especially in type C. If we take a liver sample during the presence of symptoms, in type A, we will see hepatocyte swelling with Councilman bodies. In type B, we will see cytotoxic T cells, which will cause a lot of cellular damage, including ground glass appearance, which is due to accumulation of antigens within the hepatocytes. In type C, we will see macrovascular steatosis. Type D is basically identical to type B because it requires type B for infection. And in type E, if a patient was pregnant, we will see patchy necrosis. And here's a small quiz to test your retention. What is the incubation period of the following hepatitis viruses? And here are the answers. Alright guys, that's all I have. Thank you so much for watching and hopefully this helps.